Hi there, folks. So I really want to talk about a situation that's really concerning me at the moment. That's come to my attention recently, and that is the situation, the plight of many residents within care homes. I'll be talking specifically about UK care homes, but I suppose it's also relevant as well to those suffering similar situations within other countries experiencing social distancing, America, European countries, and perhaps elsewhere as well, I imagine. Um, Currently, here in the UK, many care homes have now either totally banned any visitors or they have severely restricted any visitors. In fact, they all have. There are a large number that have allowed some visitors, but under very strict conditions, where someone is critically ill and very dependent upon having a visitor, and also that visitor goes through certain protocols, that they restrict their contact to that one resident that they're seeing, and that they perhaps in some cases wear masks, gloves, sanitize. So there are many other care homes, however, that are not allowing any visitors, that have completely closed their doors to all people. So no family members are allowed any visits at all to UK care home residents. I don't know so much about the policies elsewhere, but I suspect it's probably similar. And the argument for having such measures, of course, is to try and stop the spread of the infection. If people limit the contact that various people have. And I suppose there was a stronger argument for that to be more enforced, in particular because of the vulnerability of many residents within care homes due to the fact that they have got long-term illnesses, many of them, whether that's long-term mental health illnesses, particularly like dementia in the care home ward, but also like long-term physical health conditions. Many elderly people have arthritis or conditions that affect various organs, the heart, the lungs, the kidney, or COPD, emphysema, brain conditions, various assortment of different physical conditions that one's more likely to get through wear and tear of aging. And so, obviously, people that are concerned about the infection, very elderly people, are thought to be much more at risk from infections. And so, one can understand why there's been a big movement and an acceptance of that movement from many to try and isolate many residents to prevent them from having an infection. However, what we've been learning over the last few weeks and over a month, is that this has been having a really awful effect emotionally, mentally, and now even physically on many of the residents, actually. So much so that it's caused many to begin questioning the effectiveness of such stringent methods and whether some of those should be at least relaxed somewhat. And there's a good argument for that, and I'm just going to give you some points about that. Lots of family members have been concerned about their relatives and the diminishing quality of life. I've been reading anecdotal accounts of people visiting their family members or talking to them on the phone, and of their family member not recognizing them, or of there being some sort of cognitive decline where they're not as able to communicate as they once were. There are family members who are reporting that their family member residents in the care homes are more depressed, more anxious, because they are more isolated. Some have reported that they are at increased risk of getting bed sores. And one reason for that is that residents now are being isolated, not just within a home, but within a bedroom. This is not a stay-at-home policy for them. This is a stay-in-your-bedroom policy. So, although we're thinking for many of us it's been somewhat limiting, it's been a hardship for many that have had to stay in their home for long periods of time, but how much worse, therefore, for those people whose movements are even more restricted. There are many residents that are being prevented from leaving their own bedroom, in fact. Now, the argument for doing that is to prevent them from interacting with other residents in the home, thereby lessening the risk of infection from other residents. Now, you can see the argument for that. The less people you're in contact with, therefore, the less risk of any infection. Whether you agree with what the risks of the infection are or not, that's a different but related issue. But you have to consider the quality of life that somebody who's being locked in a bedroom 24/7 for weeks on end, and over a month now, who already has serious physical and or mental health problems, and they will only see a carer for limited times during that day. Now, I know that from my experience visiting many care homes over many years, my own mother was in a care home, I visited 6 or 7, I've worked in several over the years, and I know that the overwhelming majority of care home staff do an amazing job. They work tremendously hard. The wages aren't that great. They work on the minimum wage or living wage, and they work really long hours. They do very hard jobs. It's very physically and mentally demanding for them. It's very constant. Apart from your breaks, you're kept busy the whole day through. It never lets up, to be honest. There's always more that you can do. And you are constant there. If you're not doing meds rounds, food, cleaning, talking, you're changing pads, washing, cleaning, clearing up spillage and the rest of it. There is never a free moment except for when you have your break just to sort of have a rest. They're constantly busy there, and I know that they do work and they do an amazing job. And I think the overwhelming majority of staff, I think they are deserving of more than an applaud, and something like a wage increase perhaps might be nice, or perhaps more help in the home, to sort of lessen the burden that they're carrying. And I'm sure that the staff will be making an extra effort to help those residents most vulnerable and more isolated within their rooms. And, but there's still a limited amount that they are able to do when you think about the ratio of staff to residents. If you go and try and spend more time to comfort some resident that's distressed in their room, then you're naturally going to have less time with other residents that may also be distressed too. When you are limited in your capacity with the amount of time and resources that you've got, that's all the more struggle. And so I really feel like this is a really sad, sorrowful situation that's taking place at the moment. And I hope some of the care homes relax their measures somewhat, at least to allow some of those residents access to visitors that may be of great benefit to them emotionally, mentally, physically even. What a comfort it can be to someone going through real distress to see someone that they may depend upon and really care about as well. When in the UK, this was according to a Guardian article just a few days ago, hospitals suspended all visits according to regulations at the start of lockdown. I think that was over a month ago now, perhaps 6 or 7 weeks. But they made 3 exceptions according to the guidelines when visitors would be allowed. And they were during end-of-life care, when somebody is in labour, when a woman is in labour, that is, and when children were admitted to hospital so that they could have parents or a legal guardian visiting them. All quite sensible and necessary, I would say. But however, the Guardian article is actually claiming that many hospitals are still not following this clear and explicit advice. And I'm quoting from this Guardian article. And they say, John's campaign for the right to stay with people with dementia looked at the website of 52 mental health trusts and found that only 12 were allowing close relatives access to mental health inpatients. So the Guardian are claiming also that many acute hospitals are failing to open their doors to visitors who their vulnerable patients are actually dependent upon seeing. So despite that explicit advice being given to hospitals and NHS trusts to allow visitors when the actual patients are in a critical state where their health is dependent upon seeing those visitors. Somebody who's got dementia, for example, may be in that situation. But apparently, The Guardian allege, at least, that's not always happening at the moment. And that article came out a few days ago. So that's quite concerning in itself. I can understand trying to limit the amount of people because they have those fears about the infections. But you have to consider the quality of someone's life. Life isn't just about the quantity and how long we get to stay alive. If you are going to enforce measures for a long enough period of time, just put yourself in the shoes of someone who has got some sort of stage of dementia. They're really confused. They're really distressed. They're not sure what's going on anyway in life without all this worry over COVID-19, right? They've got their own problems. They may also have physical problems as well, right? And so somebody in that state, that condition, expecting them to be on their own without any visitors and without interactions with other residents 24/7 for weeks on end. And if you expect to continue that months on end, how on earth do you expect that person not to be totally distressed, anxious, possibly depressed? That could actually end up lessening their lifespan. If you depress the quality of life for someone to such a degree, if they are having no interaction with anyone or severely limited interactions, obviously I know that there will be home carers who work very hard and they often do make a great effort and they are often well equipped with the skills to know how to relate to people within those conditions, right? But their time still is quite limited. And so the interactions that they have with them, however well-meaning and positive, I'm sure that they often are, but they still only make up a small percentage of the overall day. The vast majority of the time, for many residents locked in their bedrooms, will be spent on their own. And now we, on the outside world, many of us have got that technological capability where we are able to communicate with others. We can Skype, we can Zoom, Facebook, tweet, Twitter, Instagram, or whatever. Many of us can even go out for our daily exercise. We can talk to our other housemates. We've got the telephone even. Many people who are elderly have got restricted uses of that sort of communication. They may not be internet savvy. Right? Even people with dementia may not even be able to talk on the telephone with residents due to their condition. So we've got to consider people in those situations are even more limited through their technological incapacity because they're not often going to be able to use those technologies to communicate with their family members on the outside. Some do, and I know that there have been care homes that have made an effort to try and Skype the families and involve them. And that's good, and they've obviously used the telephone where that's more able, and so that there have been some, thankfully, that have been able to make some contact through the technology. But there are others, however, that aren't benefiting from that because of their condition, and that's quite limiting for them. So I would say, and I think there are many others that share that sentiment, that we need to consider the quality of someone's life, not just keeping them alive and preserving them for as long as possible. Because if someone's life becomes intolerable, if it becomes insufferable, well, actually, if they are spending all day totally upset, neglected for long periods, with severe mental and physical problems, and not able to talk to anyone for a majority of the day, and not seeing residents, and not seeing outsiders, their family members that they may have depended upon for visits, and not always able to talk to them either through their lack of ability to use technology. For some people, that would have created a situation where it would have really decreased the quality of life to such an extent where it may even be intolerable, where death may be more preferable. And that's not a nice thing to say. And I'm not saying that's true for everyone confined to their room. Some people may still have an adequate quality of life because there are a whole spectrum and a variation of different types of suffering, different types of conditions. People have a complex variety of different mental, physical, and social limiting conditions. So it's a whole mixed picture, but there will be some people that are experiencing it much worse than others, actually. And so I would say, at least for those people, it's kind of important to try and assess what can be done to help improve the quality of their life as well, And as well, I've heard reports that activities, of course, have been limited within the home. People that often coordinate such activities often come from outside of the home and they've been prevented. And if residents are being prevented from meeting up within their own homes, then they can't participate in those interactions of the types of activities. And so much studies have proven that those types of interactions of keeping people active mentally and physically are so important for long-term progress and for keeping people's quality of life to a sufficient standard, really critical, especially when you have a long-term condition that may be progressively getting worse, They're the sort of things to really consider. At the moment in the UK, there are 15,000 care homes at the moment with approximately 450,000 residents. And it's a really concerning situation. But I don't want to exaggerate and make it sound worse than it is. I'm not in full. I don't fully know all the facts anyway. Yet some of the information I'm receiving from various articles is certainly concerning enough. I know that there are some family members that are seeking legal counsel and are even taking measures at the moment to remove their family members from care homes so that they can care for them back at home in some different way. They're reconsidering the type of care and whether it's really appropriate, what's going on. And they're trying to persuade some care home managers that it's within the interest of their family member that they are allowed to visit. Well, no, I know that there were guidelines explicitly giving advice to NHS trusts to allow visitation to people with certain conditions like dementia, whereby without those visitors, it would have a severely limiting impact on the quality of their life. And I would really implore care homes to really consider not just preserving the quantity of their residents' lifespan, but also the quality of their life. And all the more important as these measures go on, because if someone's suffering something that's real hardship, if that goes on for a longer period of time, how much worse, therefore, can it be? So really serious issues for care homes to consider. And I don't doubt that care homes, they do consider the welfare of their residents, and that's the overwhelming majority of people go into that for that reason, But obviously there are various pressures that they're under too. People are upset if they allow visitors in there because they consider that could be putting their own family member and other residents at risk. But personally, if I look at it logically, if you're allowing someone to go and visit a residence, you can still limit their visit to just seeing their family member alone. They don't have to go and talk to and associate with the other residents of the home, especially if that is of a benefit to the emotional and mental and even physical well-being of their family member. I would say, that's not necessarily putting anybody else at risk, but could be a real benefit actually to someone going through a real hardship and a deprivation. These are people who have got a right as well, and who often haven't got the ability to speak out and speak up because of their conditions sometimes. If you've got dementia, you're not even aware of what you're going through, are you, a lot of the time, especially if it's in a later stage of the condition. And so it's family members that have that duty to speak up for them and are doing that. And different family members are obviously debating and discussing that issue with themselves, and important they do, and come to those decisions of what they feel in their heart is right for their family member, and to discuss that with care home managers and to try and persuade them of what their rationale is and why they feel that. It's an ever-changing situation, but my own feeling on it is that, when people's life is limited and the average time that someone spends in a care home is several years, in fact, some people spend a lot longer. I've known people to spend 5 years and longer in care homes, actually. But I also have known many people spend just a few months there. The average lifespan of a resident in a care home is just a couple of years. But it does vary from a few months right up to many, many more years. But of course, there is that issue as well, not knowing, sometimes you actually can know when someone's going to die because the symptoms are clearly there. It's progressing, it's getting worse, it's obvious. It's not always the case, though, of course. My mum's case, for example, recently, she did seem to be getting worse due to an infection, but then she'd got on worse before and recovered from previous infections. So I wasn't totally sure. And, I didn't absolutely know it was getting to the end of her life at that point. And sometimes you don't really know, somebody can pass away and it can still be quite a shock, can't it? So, we don't always know. And, it's just the idea that somebody is not there to say goodbye to a relative in the last few weeks or even months of their life, because we tend to think, somebody who's older, well, they've lived their life, haven't they? But you know what? Your life is very precious, and especially when your life is very limited, when you've only got so long left, how much more important is that limited time you've got with your family members? So it's a really critical and important thing for anyone to sort of decide upon. And, when you've only got a limited time left, you don't know how long it is. So you have to make the most of that time you do have with the relatives in your life. And, I hope that relatives are allowed to visit their relatives that are ill in residence and care homes, both for their own sake, but for the sake of the relatives who are ill too. And I'm sure that could be done in a way where they don't have to go off and mingle and meet other residents in the home and put them at any risk at all. They could simply visit on a one-to-one, and majority of family members are not going to do that to put their relatives at risk. They're not going to go in and visit if they've got symptoms of an infection. They will go in and visit, and they will take precautions and sanitize and wear gloves or masks if they think that's right, and limit their contact to just their relative alone. And I think that sounds sensible precautions. And to me, it sounds like the idea of limiting contact and visits to someone who may be in such a critical condition really doesn't consider the actual quality of their life and how important and valid that social contact really is, and especially for someone who may be nearing an end of life position, how much more important is it? And so that's basically my thoughts on the situation, and I'm certainly going to do more research, and I will encourage other people to do that too as well.